bacteria ends up forming spores when the conditions become unfavorable so that they can be able to survive. Now, some species are mortal, others are not mortal. And another thing that is so peculiar with the bacteroids is that they have got sphingolipids, okay, which is found in the cell membrane. And this is not typical of majority of the bacteria. So where are these guys found? They are predominantly in the GIT, especially the large intestine, the colon, and they're also present in the oral cavity and also vagina. This is part of the normal flora there. They can as well be found in the soil and also in water. So the genus Bacteroides has got more than 90 species and also subspecies. So when you look at the GIT has got a lot of bacteria, and most of them are anaerobes. They live and without oxygen. Okay, and the majority actually of the bacteria found in the GIT, as I've said, they're anaerobes. Of course, you can find some few, okay, aerobes, but majority are the anaerobes. Most of these bacteria, they are normal flora in the GIT. They don't cause infection. But an exception of those is the bacteroids, which tends to cause infection. So these bacteroids are common in the human body and the most frequent member of the intestinal microbiota. They are the most common member of the bacteria that you're going to be able to find in the intestines. And most important disease causing species of the genus of this genus is actually the Bacteroides fragilis. Okay, so I've got the bacteroids, but the most important of the genus is Bacteroides fragilis. Now, the Bacteroides fragilis is clinically the most important species. It can become opportunistic pathogen if they escape the GIT. Remember, this is normal flora of the GIT. Okay, of course, found also in the oral cavity, in the soil, in the vagina, but especially in the GIT, the normal flora. But once they move out of this location, they'll tend to cause infection. When do they tend to move out of this location, especially during surgery or if there is trauma and accident and such? They're associated with abscesses. They can cause an abscess, like in the abdomen, in the brain, in the lungs. They can cause appendicitis, inflammatory bowel disease. So another important thing with the bacteria is they are known for antibiotic resistance, especially the beta lactams and clindamycin. So they are resistant to the beta lactams. So again, these bacteroids are anaerobic bacteria which colonize the large intestines. They are part of the normal flora. They are normally going to protect us, right? That's the function of the normal flora. Okay, they're supposed to overcome. They are there to maintain that balance so that in case another bacteria that should cause disease comes in the body, it is not going to be able to cause infection because there's already another bacteria there. Okay, but they tend to cause infection when anything happens. Okay, when they move out of their endogenous homes to areas which are normally sterile where you're not supposed to find bacteria, that's when they cause infection. So endogenous infection are characterized by the presence of polymicrobial mixture of organisms. In other words, infection that these guys normally cause, you not see only one species. There are going to be a lot of species, all right, besides the Bacterius fragilis, you see other microbes, other anaerobics, bacteria, all right? So B. fragilis is commonly associated with intra-abdominal and genital infections. So, what are the main characteristics of Bacteroides fragilis? It is a gram negative. The cell has got a capsule, so it is encapsulated. And then the cell contains lipopolysaccharide, but has little or no endotoxin activity. So this lipopolysaccharide is not like the other bacteria that we've discussed, like the Neisseria that to have the endotoxin activity. They also have pleomorphic rod shape. They are rod in nature. They are not cocci. Okay, they are a rod. They are longer uh, in the sides. And then they have got different shapes, pleomorphic. They are anaerobes. Again, they are stimulated by bio. Okay. They are able to grow on bioescreen agar. Please take note of this for diagnosis. If you want to diagnose, you do culture, you culture them on this medium, the bioescreen agar. And also they have got resistant to a lot of antibiotics, including also gentamicin. They grow rapidly in culture and they grow on blood agar also. So with the pathogenesis, what happens is that they have got adhesins, all right? They are going to be able to adhere to surfaces. So they have got fimbre or the short surface filaments, which allow them to be able to stick to the epithelium and also to extracellular matrix proteins like fibrinogen. So they can stick to epithelium of the GIT, including some other areas, including also to extracellular proteins like fibrinogen, fibrinonectin, lactoferrin, and this will help them to be able to colonize and persist in the mucosal environment. And then the peritoneal, they prefer actually the peritoneal surface. And this is why they cause the intra-abdominal infections. Okay, each polysaccharide capsule makes it actually usually good at sticking to peritoneal surfaces. And this addition is what allows them to outcompete other anaerobes during intra-abdominal infections. And then the capsule acts as an antiphagocytic shield. So it stops phagocytosis. The capsule is the major virulence factor, and it's the one that is essential for formation of the abscess and also chronic infection. So the capsule very important. Okay. So these guys will be able to produce short chain fatty acids, especially succinic acid during metabolism. And when they produce these fatty acids, they'll inhibit again phagocytosis and weaken intracellular killing mechanisms. So the mechanisms that the body has to kill bacteria will not be able to work because of these short chain fatty acids. Okay, so basically they will make our immune system dull so that it does not attack them. Bacteroides fragilis has got a toxin, the Bacteroides fragilis toxin (BFT), which is a heat labile zinc metalloprotease. This is a toxin. It is heat labile, meaning that it can be destroyed by heat, and it is a metalloprotease. Okay, this one, what it does is that it will be able to disrupt the tight junctions in the intestinal epithelial cell walls. And when the tight junctions have been disturbed, it will be able also to stimulate chloride secretion. When chlorine gets to move from the cells, the epithelial cells, into the lumen, water follows also, and that leads to diarrhea and fluid loss. Okay, these toxins also triggers interleukin 8 release, and that will make the neutrophils to be recruited. And when the neutrophils go to an area, that is acute inflammation, so it leads to inflammation. So basically the Bacteroides fragilis toxin causes disruption of the intestinal epithelium, causes diarrhea and fluid loss, and also inflammation. What are the clinical diseases caused by Bacillus fragilis? Intra-abdominal infections, gynecological infections, and gastroenteritis. These are main infections. So for the intra-abdominal infections, it's the most common setting. Okay, it's the most common disease that is caused by Bacillus fragilis, and it occurs after disruption of intestinal barrier. For example, if there is trauma, if during surgery, if there is a perforation, so there's going to be leakage of these bacteria, and when they leak, okay, from the GIT where they are normally found, they end up going into the peritoneal cavity, and that is going to trigger immune response. So normally the diaphragmatic lymphatics will play a good role in trying to clear up this bacteria. But then the thing is that the bacteria is not going to be eliminated quickly. Okay. So the body shifts from clearing the bacteria to trying to surround the bacteria so that it doesn't move anymore. And that the cells trying to surround the bacteria so that it doesn't move is what creates an abscess. Okay. So there's this walling trying to form a wall around the infection. And that is what causes the abscess. Okay. So an abscess comes as a result of inflammatory response. And this is because when the bacteria has moved from the lumen and it has gone into the abdominal cavity, the peritoneum, the blood vessels, so just the presence of the bacteria in this wrong location is going to stimulate the incoming, or because of the interleukins that are going to be released, there is going to be stimulation of the neutrophils to start coming into the area. So How does that happen? There's going to be increased vascular permeability, and then plasma influx and fibrin deposition. So this increased vascular permeability to allow the cells to be able to come to the area, the neutrophils to be able to come to the area to move from the blood vessels, and also fibrin will start to be deposited. Okay, so the bacteria near the peritoneal mesothelium is going to get trapped. The mesothelium, remember, this is just an epithelium surrounding the peritoneum. Okay, so the bacteria that is near this area will be trapped in fibrin, and that will create this abscess. And then a fibrous capsule made of collagen will be able to surround the necrotic area. So we basically have the cells that are going to attack the bacteria. So I've got some dead cells, live cells, the bacteria, the neutrophils, and then these guys are surrounded by this capsule, okay, because of the fibrin. And that is what makes up this abscess. Okay, inside the abscess, there's a necrotic area. I've got dead and live white blood cells, bacteria, debris, and these will resemble abscesses typically caused by staphylococcus or species. So another thing is that dominant, of course, in this abscess, the bacteria that you are going to normally see is the Bacteroides fragilis, but it's not the only one. You see other facultative anaerobes. So these are guys that normally work where there's no oxygen, but they can as well work when the oxygen. And also you can also have strict anaerobes, which only survive where there's no oxygen. For example, Clostridia and anaerobic streptococci. So all these bacteria will also be present with these abscesses that have been formed. Okay, so the abscess may expand to nearby tissue, and that will cause necrosis. This is basically cell death. The abscess can also get to serve as a reservoir for the bacteria because the bacteria has been surrounded. Okay, it can act as a reservoir. Later on, the bacteria can enter the bloodstream, causing bacteremia. It can also spread to the rest of the body, and that's known as sepsis. Okay, so there'll be septic shock or metastatic abscess in distant organs. Okay, so you can see this is an abscess in the liver, and then you can see this one here, which is also showing an infection of the peritoneum, which involves, of course, a lot of different types of bacteria. Another infection caused bacterial flagellates besides the intra-abdominal infection is the gynecological infection. So here again, there'll be a mixture of anaerobes, okay, which will be able to cause, which will be responsible for infections of the female genital tract. Female genital tract. So Bacteroides fragilis is common responsible for abscess formation in the uterus and also the genital tract. So what are some of the gynecological infections that can be caused by Bacteroides fragilis? You have got pelvic inflammatory disease, abscesses, surgical wound infections, endometritis, inflammation of the endometrium, tubal ovarian abscess, post-surgical or post-abortion infection. So remember we said that especially after a trauma, this is when infections normally happen. So after surgery, that's trauma, post-abortion. So there can be trauma there. Okay. Pelvic inflammatory disease. This is basically sexually transmitted disease and all these others. So the capsule plays an important role. Another infection is gastroenteritis. So this bacteria actually produces a toxin, the enterotoxigenic B. fragilis toxin. Okay, enterotoxigenic toxin. So you specifically have the bacterial fragilis, which is known as the enterotoxigenic B. fragilis, which produces this toxin. This is a culprit that will cause gastroenteritis. You have got different types of this bacterial fragilis, but specifically the enterotoxigenic is the one that will cause gastroenteritis. So majority of the infection have been observed in children younger than 5 years, although it can be repeated also in adults. Okay, so this type, the enterotoxigenic B. fragilis type, produces the Bacteroides fragilis toxin BFT, which is a metalloprotease that we had mentioned earlier that destroys the epithelium, causes interleukin 8 to come, causing neutrophils inflammation, and also causing water diarrhea because of the chlorides secretion. Okay. So this infection and gastroenteritis is going to be associated with inflammatory diarrhea in children and adults, and also there is a possible link to colorectal cancer in chronic infection. So how do you diagnose the condition. Okay, how do you diagnose infection caused by Bacteroides fragilis? Number one, you have clinical suspicion. Okay, you suspect intra-abdominal abscess in patients with if someone has got a history of appendicitis, diverticulitis, or abdominal surgery. Okay, you'll be thinking, this one can have an intra-abdominal infection. Okay, if they have got an abscess and then you are suspecting an abscess actually if they've got appendicitis, like inflammation of the appendix. Okay. And normally, how are you going to know that they have got inflammation of the appendix? If you go to what we call the McBurney's point to try to press there, and then someone is having pain. So McBurney's point is located a distance two-thirds from the umbilicus to the superior iliac crest. Okay, the anterior superior iliac crest, two-thirds from the umbilicus, that distance, that's where you have the McBurney's point. If you try to press there, someone has got pain. Yes, that is appendicitis, especially if they also have got a history of surgery. Other conditions that are predisposing to intra-abdominal infection. So if they have got other conditions that can predispose them to intra-abdominal uh, s- infection. For example, they had trauma or something like that. Okay, what will be the presenting symptom? There will be persistent or localized abdominal pain, fever with increased white blood cells, leukocytosis. Okay, so the first thing in diagnosis is clinical suspicion. Number two, you can also do some imaging techniques to confirm and localize the abscess. So you can do an ultrasound. An ultrasound is for superficial or localized fluid collection. Okay, if there is fluid that has collected, you want to localize it. And then CT scan is gold standard. You want to detect and localize deep abscesses. MRI also. These are all imaging techniques, especially for soft tissue. Okay. You can also do microbial diagnosis. Here you get a specimen for culture. So you can get an aspirate from the abscess. But please take note that when you get that aspirate, okay, the contents under sterile conditions, and you're supposed to transport. So whatsoever what you've gotten, right, the aspirate you've gotten, you should transport it using anaerobic collection system. Why? Because this bacteria is killed in oxygen. Remember, it is an anaerobe. It is killed when there is oxygen. So you need to make sure that the collection system is anaerobic so that the bacteria can survive. Because culture want to grow the bacteria, but you can't grow something that is dead. It will appear negative. Okay. So another thing is you actually incubate under anaerobic conditions. All right. So you can also do advanced techniques like the 16 srna gene sequences to identify the species. Okay. Though this one is expensive and time consuming. So you see, when you grow the Bacteroides fragilis on this, what is known as the bioescreen agar, which is of course the culture medium for the Bacteroides fragilis. So the Bacteroides bioescreen agar BBE. You are going to see where you have got the bacteria. You are going to see the blackening of the agar there. Okay, this side there is no. So the bacteria is growing. So treatment. How do you treat infection by Bacteroides fragilis? You can give antibiotics with surgical intervention, which is going to be so antibiotics combined with surgical intervention is the main approach. So Bacteroides fragilis and other anaerobes normally produce beta lactamases. So they might not be treated with penicillins, cephalosporins, because those are beta lactam antibiotics. So the main drug of choice is metronidazole. Okay, you can also give carbapenems like imipenem, meropenem. Beta lactams, if you want to give them, you should also give a beta lactam inhibitor. Okay, because these guys will be producing a beta lactamase. So the drug that you should use, you should also give a beta lactamase inhibitor so that whatsoever enzyme that is produced by the bacteria shouldn't destroy your drug. So some examples, you can give a penicillin combined with a beta lactamase inhibitor. For example, piperacillin and tazobactam. So the tazobactam here is a beta lactamase inhibitor. The piperacillin is a penicillin. So some questions to see if we've gotten it. A 24-year-old woman was diagnosed with pelvic inflammatory disease. The infection was found to be polymicrobial and included gram-negative anaerobic rods. Identify the most commonly and the most likely anaerobic involved in infection. Remember, in a pelvic inflammatory disease, okay, this is a gynecological infection. And you have got gram-negative anaerobes, which are rods. With a polymicrobial infection, the most common infection there is going to be Bacteroides fragilis. Of course, chlamydia, gonorrhea, these guys are responsible, Treponema pallidum, these guys are responsible for causing an STI, like PID, pelvic inflammatory disease. But if that guy is a gram negative, okay, it's a rod, it's mostly Bacteroides fragilis. Which of the following best describes Bacteroides fragilis? Remember, a gram negative bacilli. Where is the Bacteroides most commonly found in the human body? It is the colon, right? Okay, of course, also found in the soil, found in the oral cavity, the genital tract, the vagina. What is the major virulence factor of Bacteroides fragilis? It is the capsule, all right, which will help in causing infection and also hiding from phagocytosis. Which antibiotic is typically effective against Bacteroides species? So metronidazole is the main drug of choice for Bacteroides fragilis. Bacteroides infection are often associated with which of the following clinical scenario? Dental caries, post-operative wound infection, meningitis, UTI. Remember we said that trauma is going to be a risk factor. So post-operative wound infection. What condition might predispose a patient to intra-abdominal abscess? Okay, we had mentioned this already, isn't it? Appendicitis, diverticulitis, abdominal surgery, basically trauma. All right, these would predispose someone to intra-abdominal abscess. What is the purpose of imaging procedures in the diagnosis of intra-abdominal abscess? So the reason as to why we do an imaging is basically to see where the abscess is, to localize, to confirm and to localize the abscess. Okay, because the diagnosis you start with clinical suspicion and later on you want to confirm with imaging. How should specimen for culture be transported in the laboratory? Remember, you use an anaerobic system where you don't have oxygen because oxygen kills. Okay, it's an oxygen free system. What is a reliable but time consuming method for identifying species in intra-abdominal abscess? So remember we had said the one that is reliable but is time consuming is where you do the 16S RNA. Okay, but so that is the sequence analysis of species for specific genes where you are using the 16S RNA typing. What type of environment is required for incubating specimen to recover anaerobes? Remember, anaerobes, you need an anaerobic environment, otherwise, these anaerobes will be killed.